Good day, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. This is the RNA series number 25. RNA is nothing but random questions in neurology and neurosurgery with answers by me, that is Dr. Gireesh. This is to benefit the practitioners in neurosciences, neurology and neurosurgery, and also in the medical field, and this is for a lifelong learning and also for public awareness. In this series number 25, I am addressing this question: outline the types of treatment for craniosynostosis. One is the minimally invasive craniosynostosis surgery. Minimally invasive surgery can be used to treat patients with various types of craniosynostosis. It is reserved only for young infants younger than 4 months of age. Patients who have minimally invasive surgery will wear a custom-made helmet for a few months after the surgery. The helmet will gently mold the child's head into a more natural shape as the brain grows. Endoscopic craniectomy or a strip craniectomy. One of the most common types of minimally invasive surgery is an endoscopic craniectomy or a strip craniectomy. The surgeon will remove the suture by making small incisions or cuts on the scalp. A small camera endoscope is used alongside the CT imaging to work in exactly the right spot. When used to treat the sagittal synostosis, this procedure is called as endoscopic strip sagittal craniectomy. Cranial springs. This surgery starts with a strip craniectomy where the surgeon will remove the fused suture. After that, surgeon places a stainless steel spring in the newly opened suture. This gives the brain room to grow. The surgeon will remove the springs a few months later. This procedure is typically used to treat sagittal synostosis. The other forms of open craniosynostosis surgery are cranial vault reconstruction. The surgeon will remove the pieces of the skull near the fused suture and reshape it to allow the room for the brain to grow. A cranial vault reconstruction may be done on the entire skull or in individual sections. It is also called cranial vault reconstruction or a cranial vault remodeling or a cranial reconstruction. A cranioplasty repairs the skull anomalies or holes. A surgeon may repair the skull with child's original bone, autologous cranioplasty, or may use artificial bones, allograft implant as well. The skull cranial vault distraction is another form of surgery, and this surgery is to expand part of the skull, usually the back of the skull, posterior vault distraction. During the operation, the surgeon will remove a piece of the skull. They will put in a medical device that is secured by screws. The device allows the skull to increase in size. Once enough, the bone grows back. The surgeon will take out the screws and device. The other one is a frontal orbital advancement. A frontal orbital advancement removes and reshapes the skull bone around the forehead. It is often used to treat older infants who have a severe metopic synostosis or coronal synostosis. That's in very brief an outline on the types of treatment that are available or surgical treatment that are available for craniosynostosis. This is all done especially either as a cosmetic or it may be done for even saving the vision. Minimally invasive craniosynostosis surgery like endoscopic craniectomy or strip craniectomy. The other form is a cranial springs, cranial vault reconstruction, cranioplasty, distraction, cranial vault distraction, or the frontal lobe advancement. That's in brief an outline on the treatments or the surgical treatments of craniosynostosis. Thank you very much.